And once again, welcome to Leading Edge. I'm Jerry Anderson. Another huge story of this week is the COVID-19 vaccine rollout, if that's what that was. Vaccination totals have fallen far short of stated goals. I've actually had doctors, physicians calling me describing the campaign in terms that, well, I can't use on TV. So I'm turning to somebody I respect, the commissioner of the Wood County Health Department. Ben Robison is along. You hold them what? Masters in Public Health? Is that what I read? MPH?
Yes, sir. That's right. Right here from the Northwest Ohio Consortium for Public Health in Bowling Green and UT.
I wish I had said all of that. You said it so much better than me, Ben. Welcome in. He's been very visible in the second largest county in the Metro Toledo viewing area. Mr. Robison, as we talk, this is late in the week that we are recording this, folks. And this is a very fluid, no pun intended situation. But so far, the slowness of our rollout that is frustrating some, disappointing other. Is it more, Ben? Is it more of a problem? Is it a supply problem? Is it a demand or maybe lack of demand problem? Or is it a logistics problem? Or is it maybe a combination of all of those?
Well, right now, the most limiting factor for us getting through Tier 1A is the availability of vaccine.
Availability is supply side. Okay.
That's correct. Yeah. So here on the local health side, we've received to date only about 1,000 doses as of today. And we're moving all of those doses within the week that we get them. And we have hundreds of people waiting in the wings who are eligible in Tier 1A that we just can't serve yet. We are working with our county partners here just like we are, like we're seeing up in Lucas County. And this is going to continue to be a challenge. So the more vaccine we get, the more quickly we can move it. We are aware of pockets that have vaccine, haven't been able to administer it yet. We're hoping to see that vaccine either get into arms quickly or move to places where it can be used more rapidly than it is.
Why the shortage? Do we know?
Yeah, right now, because of where we are, there are 3 recipients of vaccine that are currently getting vaccine each week in Ohio. Those are pharmacies who are serving the long-term care facilities throughout the state,
right?
Hospitals that are serving their own staff as well as their provider networks, and then local health departments that are serving the remainder of the eligible individuals within their jurisdictions.
Help me on the demand side. We've talked just briefly there about the supply side. On the demand side, first responders, those on the front lines, you mentioned nursing homes, congregate settings, all up first to get the vaccine. We just need more of it, folks. They get the vaccine, that's if they want to get the vaccine. How many so far on your experience, how many are saying, no thanks?
Some are. I will tell you, even early on, people said no today, and they said yes a week or two later. So, as they see their colleagues being vaccinated, they are rethinking that position and reaching out to be served. So that's encouraging. Depending on which industry we're looking at, I've heard reports around 60% for some, as high as 90% for others. So it really does vary. And we do expect that many people may come back to this issue, even if they do it later on after we've opened up to other tiers.
Ben Robison, my guest, health commissioner here in Wood County. Help me with some basic questions I'm getting, real basic stuff. And I'm sure if I'm getting them, you're getting them, I'm sure, by the bushel basketful. Here we go. When do I know I can get a vaccine? Who tells me it's my turn to get a vaccine? Where do I go to get it? Do I have to pre-register? Can you run us through those quickly?
Sure. So as of right now, across the state of Ohio, we are still serving population 1A. So those are the people that you have talked about, the providers, the emergency medical services personnel, people in congregate settings.
Should police have been vaccinated by now? It's a huge issue for the police department in Toledo. It's been a big issue. And also, what about employees in doctors' offices? I'm thinking of primary care physicians. I mean, that's also a front line too, isn't it?
Yeah, so our first responders, as we know, are not currently included in 1A as an entire group. So our EMS personnel are, because they are directly involved in the care of individuals. But for our law enforcement personnel, some of them are not providing that care, and so as a group, they have not been included. And so as we look at the limited availability of vaccine, we want to be able to give it to everybody, but unfortunately, we just don't have enough. And so we have to make some really difficult decisions. There are some situations where we may have extra doses. Some vials are overfilled, or sometimes people will not come for their appointments that they've scheduled. And in situations like that, we have been able to use vaccine throughout the state for first responders to include law enforcement on a limited basis. When that window is small, it's tough to get people in with 45 minutes notice, but our first responders respond quickly all the time. So they've been able to be served through that avenue. But as of right now, first responders are not as a group included except for EMS, and that's just because of the limited availability of vaccine.
What about,
to answer your other question about providers' offices,
yeah,
the goal is to try to serve individuals in the entire continuum of care for COVID. So everyone who would interact with a patient in some capacity or another would be eligible at this phase. They're considered healthcare workers. So whether that's the person that you're interacting with to register, the person that is seeing you directly in the room, or even individuals who might be supporting that process, like a scribe or a translator, they could be potentially eligible for being vaccinated now because of their support of providing COVID care.
All right. Well, if they're being told they can't be vaccinated, this isn't your county, Ben. You're off the hook. This is up Lucas County way. Take it up with whom? Their health commissioner? I mean,
so right now, it really is the local health department's role to identify whether a person is in Tier 1A or not. And as a health department is dealing with the limited doses they have, there may be individuals who are going to be eligible later, but just can't be served right now. Okay. Additionally, it's worth noting that local health departments do a really good job of triaging requests that we get. So a person may indicate that they themselves are in the first tier, but as we do some investigation, we find that might not be the case. So there can be misunderstanding, and it is complicated. So it's important to engage your local health department or your hospital, whoever it is that you're getting vaccine from.
The governor so wants to get schools back into in-person teaching. Your county has a district that we both know well that has been on full remote teaching all school year. Should the matrices, which I think that's the plural of matrix, should the matrices that districts use to govern their decisions, do those have to be revisited?
So I think that it's important to note that all of these educational decisions are more complicated than just how do we manage COVID. So there are a number of logistical concerns, from how do we get kids to the school, how do we manage where they eat and movement between classrooms, what do we do with spacing and quarantine concerns. So we contribute one portion of that consideration, but the school district is looking at a number of factors. So I know that each school district, to include Bowling Green in particular, that's remained remote, is continually looking at the way that they deliver education and what they are going to do with this upcoming delivery of vaccines. So it's exciting that we have an opportunity to protect our staff. We've had good success in our districts throughout the county. It's actually reported that way across the state, that counties are doing pretty well in not identifying additional cases in schools. So there seem to be some opportunities available to us that might allow kids to be back in school, particularly with vaccine around the corner, when they may not have been able to be before for other reasons.
Yeah, believe it right there. Ben Robison's Commissioner, Wood County Health Department. Do the rest of your introduction, the title, the whole consortium thing. That was impressive.
Sure. So Ben Robison, I have a master's in public health from the Northwest Ohio Consortium for Public Health. This is a consortial program of the Bowling Green State University and the University of Toledo.
All right, got them both. Got some plugs in there. Ben, I can't imagine what it's like to be you, but it's a busy time, and appreciate what you're doing out there on the front lines to get needles into arms. Success to you. If we can help you down the road, please shout my way.
Thanks. Yeah, and one thing that we would note is, I know that Lucas County is talking about pre-registration lists and other things. One of the things that we really do need assistance with is volunteers. So if you, the easiest way to find our volunteers is to Google Medical Reserve Corps, Wood County, Ohio. And if you Google that, you'll be taken directly to our page for how you can enroll to be a volunteer. All right. Although it says Medical Reserve Corps, we take medical and non-medical, and we need thousands of people to help us to move this vaccine quickly.
Retired daily newscasters.
Absolutely.
Mr. Robison, and it's Robison, folks. Thanks for being with us, Ben. Continued success, and thanks for what you're doing out there. And I'm going to be right back.